Chapter 46 and 47 Urinary Elimination Actual Exam Questions and 100 Correct Answers Latest 2025-2026 Guaranteed. Question 1. Actual Exam Questions and 100% Correct Answers Latest. A nurse is teaching a patient about the urinary system. In which order will the nurse present the structures following the flow of urine? A. Kidney, urethra, bladder, ureters. B. Kidney, ureters, bladder, urethra. C. Bladder, kidney, ureters, urethra. D. Bladder, kidney, urethra, ureters. B. Kidney, ureters, bladder, urethra. B. Kidney, ureters, bladder, urethra. Question 2. A patient is experiencing oliguria. Which action should the nurse perform first? A. Assess for bladder distension. B. Request an order for diuretics. C. Increase the patient's intravenous fluid rate. D. Encourage the patient to drink caffeinated beverages. A. Assess for bladder distension. A. Assess for bladder distension. Question 3. The patient is having lower abdominal surgery and the nurse inserts an indwelling catheter. What is the rationale for the nurse's action? A. The patient may void uncontrollably during the procedure. B. Local trauma sometimes promotes excessive urine incontinence. C. Anesthetics can decrease bladder contractility and cause urinary retention. D. The patient will not interrupt the procedure by asking to go to the bathroom. C. Anesthetics can decrease bladder contractility and cause urinary retention. C. Anesthetics can decrease bladder contractility and cause urinary retention. Question 4. The nurse, upon reviewing the history, discovers the patient has dysuria. Which assessment finding is consistent with dysuria? A. Blood in the urine. B. A burning upon urination. C. Immediate, strong desire to void. D. Awakes from sleep due to urge to void. B. A burning upon urination. B. A burning upon urination. Question 5. An 86-year-old patient is experiencing uncontrollable leakage of urine with a strong desire to void and even leaks on the way to the toilet. Which priority nursing diagnosis will the nurse include in the patient's plan of care? A. Functional urinary incontinence. B. Urge urinary incontinence. C. Impaired skin integrity. D. Urinary retention. B. Urge urinary incontinence. B. Urge urinary incontinence. Question 6. A patient has fallen several times in the past week when attempting to get to the bathroom. The patient gets up 3 or 4 times a night to urinate. Which recommendation by the nurse is most appropriate in correcting this urinary problem? A. Limit fluid and caffeine intake before bed. B. Leave the bathroom light on to illuminate a pathway. C. Practice Kegel exercises to strengthen bladder muscles. D. Clear the path to the bathroom of all obstacles before bedtime. A. Limit fluid and caffeine intake before bed. A. Limit fluid and caffeine intake before bed.